I'm Phil Moeller. Thanks for spending a few minutes with me today. If you have a high deductible plan, many employers will help you set up a health savings account to help you deal with those expenses in the deductible phase of your plan. HSAs are funded with pre-tax dollars. Usually your employer puts in some, and you can put in the rest up to a specified annual limit that is set and changed every year by the IRS. Not only can you fund it with pre-tax dollars, but you can spend those dollars on any qualified health expense, and you will not incur a taxable event when you spend the money. So HSAs can be a great vehicle because they're rare in that they're funded with pre-tax dollars, but when you spend the money out of the account, it's not a taxable event. So it's tax-free going in, tax-free going out. It can be a great tool. And the other nice thing about HSAs is that if you have unspent monies in an HSA, you can carry them over from year to year. So you can build up some pretty big balances in an HSA, and I've actually advised people in some settings to not use their HSA. Just use it as almost a retirement vehicle, build up big balances in an HSA, so when you do retire, you can spend those balances tax-free on any qualified expense, including, by the way, Medicare premiums, which are a qualified medical expense when you retire. So HSAs can be terrific. However, there's a wrinkle in that HSAs are not compatible with Medicare. So if you have Medicare, you are no longer allowed to contribute to an HSA. You can use the funds in the account, but you can't contribute new funds to the account. And your response may be, well, that's fine because I'm going to continue to work and I'm going to continue to use my HSA and I'm not filing for Medicare. However, a lot of people as they get older, especially when they reach the latest claiming age of 70 for Social Security, it really behooves them to file for Social Security. When you file for Social Security, by law, you must receive Part A of Medicare. You can't avoid it. If you want to get Social Security benefits, you have to be enrolled in Part A. If you're enrolled in Part A, it means you can't continue making contributions to an HSA. People rarely understand this. I get a lot of questions from people who simply are surprised when they run into this roadblock. And so I'm telling you today that there is a roadblock you should be concerned about, so you shouldn't unintentionally enroll in Part A, and in some cases it can influence the timing of when you do apply for Social Security. However, I don't know of any situation when you're better off not taking Social Security benefits and using the benefits of contributing to an HSA, especially if you're waiting until age 70 to file. You should just file for Social Security and understand that that means you won't be able to continue contributing to your HSA. I hope I've helped answer some of your Medicare questions. I realize you may have lots of other questions. Medicare can be pretty complicated. MedicareMadeClear.com provides lots of answers to your basic questions. So if you still have them, I urge you to go there and see if you can get the answers you need. Thanks again for spending time with me today.